I talk about the cascade of interventions a lot. And I think there's a lot of question from people on, well, does it really matter if the cascade of interventions happens? As long as my baby is born and is healthy, does it really matter if I end up having a C-section? Does it really matter if I have to have a forceps delivery? Does it really matter if Pitocin is given to me and my baby during labor? Well, for some people, it might not matter, but for a lot of women, I will say it does matter. And the main reason it matters is because 1/3 of women currently that have given birth describe their birth experience as traumatic. It's extremely common for women to have birth trauma and things that they wish didn't happen to them. And that is why I'm so passionate about the cascade of interventions because, yes, even in a home birth setting with no interventions, things can happen that can be scary or even traumatic. But there is no doubt about it that giving birth in a hospital setting where intervention after intervention is given to a woman will likely lead to burdens. And that is the opposite of what we want. We do not want our birth, the birth of our child, to be something that creates trauma. And every time we think about it, we're upset about it. So, this is really why I'm going in on the cascade of interventions so you can understand what the risks are and what potential burdens those could be causing you and your baby. Now, I mentioned in the previous module that one of the things that can happen if you have, let's say, your birth ends in a C section, is the higher chance of a more difficult time breastfeeding. This is just a known fact that C-sections will lead to a more difficult time breastfeeding or women less likely to breastfeed. What I want to go over some of the side effects that your doctor likely isn't going to tell you for the different drugs that are given during labor with these types of interventions. So I'm going to go over those side effects that are listed. You can find all of the information that I'm going to discuss on the FDA website. You can look up the inserts for every single drug that would be given to you. And just keep in mind, anything that's given to you during labor is also being given to your baby. You guys are one while you are pregnant, and there really is no barrier between your blood when you are pregnant. So just keeping that in mind as you receive this information and make educated decisions on what you want to do in labor. Before I dive in, I do want to say again, if you are someone listening to this who has had a baby before, but you're deciding that you want more education on what to expect and how you could do things maybe differently for your next birth, I just want to applaud you for even getting to this point. And there's absolutely no shame when it comes to your previous births. If you receive information or you discover information in this course that is eye-opening to you, that is maybe concerning to you, this is not to condemn you. Everyone, you only know what you know until you know something different. So just take the information and understand that there is no shame, and you're doing an amazing job just by gathering more information and preparing for your next birth. There are obviously a lot of different pharmaceutical drugs that can be used during labor. So I'm really going to touch on two of the most common, and two of the most common when we talk about the cascade of interventions, and even going back to that scenario that I covered. So the first drug I'm going to talk about is Pitocin. I've mentioned it a couple times already in this course, but Pitocin is a synthetic oxytocin. It is approved by the FDA for patients after miscarriage, during an abortion, inducting or accelerating labor, and for postpartum contractions. Now, it says on the insert for Pitocin that it can cause the following. So I'm just going to read off, and this is not limited to what is on the insert. There's actually even more, but I'm going to read off some of the side effects that are known to be caused by Pitocin. So the first is anaphylactic reaction, postpartum hemorrhage, which is very interesting as far as it being listed as a side effect when this is one of the reasons that it's given to women after birth. It's given to women after birth to prevent hemorrhage. However, it's listed as the number 2 side effect for the drug. Cardiac arrhythmia, difficulty blood clotting, pelvic hematoma, brain bleeding, coma, severe water intoxication, maternal death, fetal death, neonatal seizures, low APGAR scores, neonatal jaundice, and neonatal retinal hemorrhage. So these again are just things that are on the insert listed as a known side effect of the drug. And I do think it's important for every woman to know that these are side effects of the drug. For me, if I'm going to take any sort of medication, I would always look at the side effects to see if the benefits of taking it would outweigh the risks. Again, I mentioned that Pitocin can be life-saving. It can help in the case where a woman is bleeding after birth or hemorrhaging after birth. It can be life-saving. So in that situation, I would say, does the benefit outweigh the risk? Sure, it does. But as far as if there's no medical indication for me to be induced, or maybe I'm even questioning what the doctor has said as far as if my induction is medically necessary, I would really want to be considering, well, if it's not even 100% medically necessary, is it worth risking all of these burdens or side effects that could come with the induction or come with having this drug put in me? Now, the second intervention or drug that I will go over that is most common in labor is an epidural. Now, an epidural is anesthesia used to supplement general anesthesia, or it can be used as the main anesthesia method in certain surgical procedures, including thoracic, abdominal, pelvic, and lower extremity regions. So, makes sense that it is being used for labor purposes. Several drugs can be used in different combinations to achieve neural axle anesthesia, which includes opioids such as fentanyl, morphine, and oxycodone. Now, remember, when you are pregnant, you and your baby are one. There is no barrier between you and your baby. So if you are receiving an epidural, all of these ingredients that are in the epidural, in the anesthesia, would also be going into your baby. And I call that out because I think epidurals are so routine that women don't really think about how it could be impacting their baby. Again, a lot of women have epidurals and their babies are fine, but I'm just simply stating the facts on the situation here, and how the epidural and the drugs that are used, the anesthesia used, would absolutely impact your baby in some way, shape, or form. According to the insert, long-term studies in animals to evaluate the carcinogenic potential have not been conducted. The mutagenic potential and the effect on fertility have also not been determined. So according to Stafford Medicine, 71% of women get epidurals or other spinal anesthesia. However, the products have not actually been evaluated for any agents that could cause cancer, alter the DNA or your DNA, or alter or change your fertility. On the insert, it says, as far as side effects, that it can cause excessive plasma levels, restlessness, anxiety, dizziness, tetanitis, blurred vision, tremors, convulsions, drowsiness, unconsciousness, respiratory arrest, nausea, vomiting, chills, heart block, hypotension, headache, backache, urinary incontinence, cardiac arrest, hives, edema, paralysis of lower extremities, and loss of sexual function. So again, you probably know someone, maybe even you have had an epidural, and you are okay, your baby is okay, and that is amazing. That is great. Praise the Lord. However, it needs to be said that there are side effects to having an epidural. So this is why I've listed off all of them, or this actually isn't even all of them. I've listed off some of them so you can make an actual educated decision when it comes to deciding if you want to opt in for an epidural, or if you want to opt in for an induction, which you may end up needing a epidural based off of knowing that the contractions are usually pretty intense when it comes to being induced with Pitocin. I even think that a lot of women have likely experienced some of the things or side effects that I've listed off, as far as side effects either for Pitocin or side effects of the epidural. And we're basically just told that it's a normal part of giving birth, a normal part of labor, and it's just something you can expect. However, in a physiological birth, you would not see those things, or definitely not see those things as common, because they are a direct response from the drug. So I also just call that out so you can have an understanding that some things that you think are normal or common or to be expected don't have to be normal or common or to be expected in your labor and delivery. The last thing I want to discuss when it comes to the cascade of interventions is to just dive in a little bit more to C-sections. So I've mentioned that the cascade of interventions the end result is a lot of times C-sections, and 1 in 3 women will have a C-section. And I understand that sometimes a C-section will be medically necessary. They can be life-saving for mom and for baby. So this is not to say that I'm completely against a C-section. I just want women to know that there are reasons why you may want to avoid it. Although society has made it very common and normalized the idea of having a C-section because it is so prevalent in our society, there really are reasons why we want to give birth vaginally. The number one thing I can think of is the fact that God created us to give birth. Why would I want to do it any other way? I want to experience childbirth the way that He designed it. So that is the first thing I'll just remind women, is that if you're even considering a elective C-section, because you might be scared to give birth vaginally, just remember the truth is that God created you to give birth. That is the best option for both you and baby. Again, if there's no medical reason, a true medical reason that you would need to have a cesarean section, the best option is to give birth the way our Creator made us to give birth. Now, as far as other reasons that you might not want to have a C-section, I have talked about the impact on breastfeeding and difficulties with breastfeeding due to the hormonal changes in your body that need to occur, and that can be tampered with a bit if you do have a C-section. But outside of breastfeeding, maybe breastfeeding isn't that big of a deal to you. There are other potential side effects or downsides to having a C-section. And some of those possible impacts are lower immunity in your baby. And this is because when your baby comes through the birth canal, they are exposed to bacteria in the birth canal that is designed to strengthen their immune system. God did not make any mistakes when He designed us to give birth vaginally. There's a reason He had us do it like that. And there's a reason why that bacteria that they're exposed to during birth and coming through the birth canal, there's a reason why that is so important for baby. The other thing I will call out as far as potential impacts of a C-section is your ability to give birth vaginally again. Now, you can absolutely have a VBAC, which is a vaginal birth after cesarean, but you will need to find a provider that is willing to work with you and ensure that there are no risks with the way that your body has healed, which most women do not have an issue there, but it poses a little bit of a challenge as far as your future of having a vaginal birth. I don't want that to be discouraging. Maybe you are someone that's listening that has had a C-section and would really like to have a vaginal birth, and you absolutely can. There's tons of information and resources out there on how to do that. A tip I have for you would be to get even into your local Facebook groups and ask questions in mom groups, ask questions about providers that are willing to do a VBAC, because without a provider that is willing to support you in that, it will make it a lot harder for you to be able to achieve that goal and that dream that you have. So you might be thinking now, what the heck do I do with all that information? That was information overload, and I'm really not sure where to go from here with all of this new information I just learned. Well, the first thing is, remember that knowledge is power. And the more new information that you learn, the better you're going to be able to make decisions that are going to create the best experience for you and for baby, an experience that will be a blessing and not a burden. In the next module, I'm going to go over steps you can take in order to decrease your chances of having the cascade of interventions happen to you. So jump on over to the next module to learn more.